many of these diseases can be enormously dangerous. So even something like measles, right, which for the vast majority of people will give rise to mild disease, 1 in 20 kids will be hospitalized with measles, right? 1 in 100 kids will have a neurological episode, might have seizures, right? And 1 in 1,000 kids might die, right? And so, those are all serious and severe and scary outcomes for families and for parents, and vaccines absolutely prevent those. My name is Matt Ferrari. I'm a professor of biology here at Penn State and the director of our Center for Infectious Disease Dynamics. Vaccines are a biological preparation that exposes the body, the human, to either an inactivated microorganism or some component of a microorganism, or actually now with mRNA, the genetic information that would allow the body to produce one of those components. These are things that can't cause disease by themselves, but they prime the body to fight off disease when you finally get exposed to a virus or a bacterium or something in the natural world. The great thing about vaccines is they help in 2 ways, right? The person that gets the vaccine is protected. And the fact that they can't get sick and transmit to anybody else means that other people are protected, right? So what we try to do is increase the number of everybody that's protected that can also provide that extra or indirect protection to everybody else. And because we know that some kids might have immunocompromised conditions, or by random chance the vaccine they got didn't work, or any number of reasons, right? We want to increase the number of people that are getting the vaccines and are protected to thereby protect indirectly everybody else that maybe can't either get a vaccine or access a vaccine or is allergic to one of its components or one of those things, right? So we're trying to maximize both the direct protection and the indirect protection. If you choose not to get vaccinated, right, that means that you're accepting the risk of getting sick in the future, right? But for transmissible pathogens, viruses and bacteria, that also means you're accepting the risk that you might transmit to somebody else. So you're necessarily accepting the risk of harm to others by choosing not to get vaccinated yourself. Generally speaking, if you get vaccinated or your child gets vaccinated, they are protected. But not everything works, not every drug works, not every vaccine works. So if everybody else around you is vaccinated, then in the random case that your kid's shot didn't work, right, and nothing is perfect, then being in a school with everybody vaccinated means that random event has minimal consequences. A really important thing is that vaccines, we have shown that vaccines can not only protect individuals, but vaccines can actually lead to the elimination of pathogens entirely, right? We've seen this with smallpox. We got rid of measles in the United States and in fact all of the Americas. Those things are only coming back now. Measles and rubella and whooping cough are only coming back now because people have been choosing not to get vaccinated. And so increasingly that risk is getting worse, the outbreaks are getting bigger, and more people are getting affected by it. We had 3 children die in the United States just this last year from measles that has previously not led to large outbreaks in many, many years.